Hello, this is Joan Meekins, the Vale of York CCG Cancer Lead. I'd just like to talk you through a new referral form that's been produced for the palliative care services. This form will be used in the hospital as well as in primary care. I'm just going to show you the new features. You'll notice at the top of the form that once it has been completed, it should be emailed to the address on the form. This email address is to be used for all referrals. Those from the community palliative care nurses, inpatient referrals, Sunflower Centre, formerly the day hospice referrals, also hospice at home and lymphedema services. On the left hand side of the form here, you'll see where the community palliative care team have got their information. There's a link here to their referral criteria and a phone number for urgent referrals. Referrals can be made for patients where the expertise of the team is needed, which is above that which can be offered by the district nurse or GP. On the right hand side of the form, referrals for inpatient unit at St Leonard's. The hospice do not want to continue to run a long waiting list for admissions, but want to be able to act more proactively towards the patient's needs. Later on the form, you'll be asked to let the hospice team know why you think the referral should be made and to describe the problem. The Sunflower Centre, formerly day hospice, offers a new range of services. Patients will be assessed and offered services appropriate to their needs. There are also drop-in sessions for bereavement, and for more information please visit the website. Hospice at home referrals, this will mostly be used by the district nursing team, and also lymphedema services, referrals can be made from primary care. This part of the form is used to record patient details. This can be auto-populated from the patient computer record. Please note, the patient's current location is very important if they are not at their usual home address. It is also important to highlight if there is any risk to a lone worker visiting the patient in their own home. The next of kin carers details. Here, an up-to-date telephone number is essential. The disease status. These boxes will expand as you write in them, so you do not need to be brief. However, a brief description of any treatments given will be very useful. An indication when an ongoing infection is helpful, as the hospice does not always have single-bedded rooms, and patients may be in a 4-bedded room. The hospice needs to know if the patient needs to be isolated or not. Any special needs and equipment and mobility aids will also help the allocation of appropriate beds. Again, any advance warning about conditions such as dementia, poor sight, etc. are really helpful. The phase of illness. Information in this section helps the hospice manage their patients who are waiting to be admitted. A patient who is unstable with problematic symptoms may be admitted before a patient who is deteriorating in an anticipated way. Admission may not be offered for stable patients who are being managed in primary care and have no ongoing problems. The reason for referral is always helpful for the hospice team, so they can consider this along with the previous section on the phase of illness. Also, the professionals involved from the consultant down to social service will also help with any ongoing patient care. Information about advanced care planning and any conversations that have occurred about this subject are important. These include DNA CPR status recording and any advanced care plan. Guidance about this can be found on the RSS website. There is a useful section underneath this on anticipatory drugs, and there's a link that is shown about how to prescribe them and how to use them in syringe drivers. Referrer details can be essential, so as the hospice may want to contact them to ask for any further information about the patient. It's also very important to let the district nurses know that this referral to the hospice or to the Sunflower Centre has been made. There's a useful area here that includes an email address for the district nurse single point of access, that's SPA, and you'll be able to email a copy of this referral to them to keep them informed. Of course, if the patient is known to the district nurses and you're using System 1, a task could also be sent. Medications. When this form is used from a hospital team, the medications will be brought through from CPD. But in primary care, when you produce a brief summary, computer summary of the patient, the medications should come through automatically. This is the completed form, and I hope you don't find it too daunting. Of course, if you would like to talk to the hospice team for urgent help, then the telephone number is at the top of the form, and they're always happy to do this for you. We hope this form will enable patients who need more input or possibly admission to be assessed by the palliative care team on the most appropriate timescale. The use of an email address for the referrals will also make this referral to be made more efficient. The form also prompts discussion about advanced care planning and enables handover of this information more smoothly. Please let us know if you encounter problems with the form or any more thoughts about its use.